MyChart is a patient portal, and that means that you can go online and access your information, information that's in your patient record, including a list of your medical problems, laboratory results, and some imaging test results. You also can send messages to your healthcare provider about concerns that you have. You can request appointments. You can also request medication refills. MyChart is very easy to use. All that's required is that you get an access code. That we give out access codes at every patient visit, and we can also sign patients and their families up at an office visit so they have immediate access to MyChart when they leave the office visit. Once they have signed up for MyChart with their access code, all they need to do is put in their username and their password, and they go right into the MyChart portal. It's very easy to see how there's large buttons that tell you this is a button if I want to look at my information, this is a button if I want to send a message. Here's a button to look at my laboratory results. You can graph laboratory results so you can see patterns over time, for instance, how your diabetes A1C has been over the last several years. Healthcare providers have found MyChart messaging to be very useful and timely. For my nurse in my practice, MyChart messages are much easier for her to use. The message comes right into the patient's chart, so she can look up other information that we need to answer the patient's question without having to try to type in a name or hear on a phone call. Another benefit of MyChart is that for older adult patients who may not be comfortable using computers, their adult children who often are involved in their care can access MyChart for their parent and help keep the healthcare team up to date on changes in the patient's condition. Also make sure that the record reflects what the patient is taking at home. In addition, we use MyChart for parents of young children for the same reason. The parent can also help with updating the healthcare information, sending in questions. There is what we call proxy access for both adult children and also for young children and their parents.